Please welcome to the stage Inovalon's President and Chief Operating Officer, John Barneson. Please welcome to the stage Rowland Illing, Murali Gandhirajan, Jen McKay, and Todd Mersch.
All right, welcome everybody. Thank you we have a great morning so far. I think inspirational hearing how customers are using technology. We've brought the nerds up, all of us, I include myself in the nerds, to talk about how it actually happens and what this transformation looks like. I was doing a little AI math this morning. I think we have roughly 2/3 of the global cloud compute represented on the stage here this morning, which is pretty incredible. And actually, if you think about it, 10 years ago, that number was probably 50% of that, and 20 years ago, it was a negligible amount. So these institutions have been really driving transformation in how we use technology, how we think about compute. Snowflake's been an incredible innovator in the last mile in making these capabilities more relevant on a sort of a domain-specific level. What we like to sort of dive into today is this moment in healthcare, maybe the next 20 years, and what this is going to look like. For many of our customers and for us, you're already a very important partner. Certainly for Inovalon, each of you are an important partner. But we'd like to sort of get your perspective on what's working, what the blockers are, and what's to come. Rowland, love to start with you. Question number one. I think when we talked a couple weeks ago, you were backstage, about to go on stage. You guys are all rock stars in this moment. What's exciting you now? What's actually happening now that's driving impact that 3, 4, 5 years ago was not even in the conversation?
Well, I don't think it's going to come as an immense surprise to anyone in the audience about, obviously, the impact of AI that's taking place at the moment. So just to put in context, I'm the Global Chief Medical Officer for Amazon Web Services. I'm a clinician as well, so I'm an academic interventional radiologist, as well as within the tech space now. So I've been really interested in how AI has been impacting care providers, payers, life science companies for many years. But really in the last 3 years, obviously the ChatGPT moment for generative AI hitting healthcare and life sciences has been immense. I think this year we've seen genuinely all of this coming into production. So I think the generative models that are actually being used in real life, based on these vast data sets, has been really interesting to come across. So I think there are two things. There's one thing about the generative models that are being built, which are these large unstructured data sets that are being used to infer things from. And I think that's, for me, the most exciting thing where Inovalon's playing, this massive data space. So there's a paper published in the Journal of Nature in September, so this is very recent, that was how transformer models can predict patient outcomes at nation scale. So a lot of what I do is speaking to national health systems. So I was in the UK a couple of weeks ago speaking to the UK NHS. You know, we speak to CMS, Medicare, Medicaid here at HHS. In the UK, in Nature was published a model that was built from the UK Biobank dataset. That's 400,000 patients, fully sequenced human genomes, pathology, imaging, clinical histories for 20 years. So they took that 400,000 patient dataset and they built a transformer model called Delphi, and they compared it against the Denmark dataset with 1.5 million people in it. And they were able to proactively predict the next disease entity, covering 2,000 different disease entities prospectively. And obviously that was better with non-communicable diseases to communicable, because that's easier to predict. But isn't that incredible? You can take this data set and tailor it to a population and then infer the next disease that everyone is going to get. I think with the power of that data and the kind of data that Inovalon's using at a US level, that will be really, really impactful. So that's what's being done today. The next step, which we're seeing coming in, is this piece around agentic AI. And I think this is where the world is going to. And again, we're really proud to be partnering with Inovalon on the agentic work. So we just released something called Agent Core, which is a kind of a quick start agentic workflow. And so agents, for those of you that may not be aware, most of you interacted with chatbots. I'm sure you've been been using ChatGPT to interact with those large data models. Agents are the next step. So agents will be able to actually undertake tasks on your behalf based upon those large data models. And so you think about, not only can you interact with the model saying, when is the next appointment available in health system X, it will actually then, you can say, make me the next available appointment in health system X, and it will actually go and make that interaction for you. And so we're seeing two very different kind of speeds of action at the moment. So we're seeing life science companies, so it's great to see some of our mutual partners in the audience, so J&J just on stage. They're doing some really interesting things around agentic workflows for drug discovery. So actually creating these agents that will go and look for drug targets and then look for the actual agents that will work on those targets and then actually design clinical trials. And so these agents are things that everyone are going to be working with in the future. And I think that's where the puck is definitely moving to. So if you're not working with agents at the moment, I'd definitely get your tech teams onto it and to think about the questions you can solve.
It's fascinating. I think about going back to the whole cloud compute journey. There was a real thought that the commoditization of compute was going to lead to prices nearing zero and sort of a very disinterested market. What actually happened is the compute piece became an enabler for high-performance computing and a lot of things that we just literally couldn't think of 20 years ago.
Have you come across the Jevons paradox?
Yep.
So Jevons paradox is in the Industrial Revolution, everyone predicted the price of the coal use was just going to go down because steam engines were getting so efficient. Who needs coal anymore? Because you just need a bit of coal to power a steam engine. Yep. As soon as the steam engines get more efficient, the amount of coal use goes massively up because everyone's using steam for everything. And that's kind of where we're going to for AI and compute, where there won't be enough compute and power to power these things as it gets so much cheaper and so much more effective.
Yeah, that feels like we're already there. Yeah. Certainly from a chip perspective.
Yeah.
Murali, love to ask you a question about the future. As I mentioned, Snowflake's in such an interesting position, really bridging cloud providers into domain-specific use cases. I think in healthcare, you probably see a lot of the forward-looking business models and opportunities. I'd love from your perspective, fast forward 5 or 10 years. 10 years seems like a long time in this market, by the way. 5 or 10 years, what should we be excited about? What's the vision there? And is it, it can be healthcare and sort of systemic, or it can be specific to clinical outcomes?
First of all, thanks for having all of us. It's great to be part of this panel along with all of you. And if you look at a technology that could transform outcomes in our industry, and particularly looking at it from that lens of 5 to 10 years, which is pretty long, by the way, in today's definition, it could range from hyper-personalized care that truly helps us to deliver precision care at patient level to virtual and ambient care that is actually driving the remote patient monitoring and thereby helping patients age in place, to technology in, like Dr. Rowland talked about, in biological sciences research. It's really helping us to do 50 years of science in 5, right? That is going to help us to find cures, discover new drugs and vaccines and so on and so forth at a pace that we have never seen before. And all of this is going to be powered by our ability to set up an interoperable multimodal data ecosystems. It's going to point back to the data. But you asked me to pick one area, so and I'm going to piggyback on what Dr. Rowland started and talk about hyper-personalized care, which is about how do we understand patients holistically? How do we bring all the relevant data of the patients together and identify and use that to then say, what is the next best action, particularly from a context of a customized treatment plan, right? How would the treatment work? How would the disease progression look like? And if you want to understand something about it from a capability standpoint, we have to look at this as like a 3-layer cake, right? At the core of it is our ability to handle any modality of the patient data, right? Whether you're looking at genomic data or medical imaging data coming from radiology systems, pathology systems, to biomarker data, to laboratory systems data, to wearable data, right? That's layer number one. And today, the technology, the fascinating part of today's technology is, like Dr. Lorna was talking about, today we have the underlying computing structure and the GPU-based infrastructure that helps us to process all of this data in a way that we have not had before, like in the last 3 to 5 years. The second layer is our ability to move data from application layer to the decision layer. Now, application layer, think of this as systems that actually generates patient data. It could be radiology system, it could be pathology system, it could be laboratory systems. And we have to have that data available to the decisioning layer, right, which is predominantly going to be driven by AI. And the speed in which we can move the data from application layer to the decision layer is going to be everything. Because if you don't have access to that most recent data of the patient, it's impossible to come up with suggestions and recommendations and next best actions that actually make meaningful sense. So think of these two layers actually giving us that breadth of that patient data, spanning back to X number of years, to X days of medical images and laboratory reports, to X minutes of the devices data and the wearable data, and all of that data being available, right? That's the core of it. And then the third layer, which is, think of this as a virtual patient model called digital twins, for example, that actually is able to bring all of this data together and then run simulation models to then say, how would a particular treatment work for a given particular patient, right? And these digital twins can then integrated into the AI, clinical decision support systems to scale the personalization of care, right? Think of this as some capability that clinicians have to run the what-if scenarios before actually trying that intervention in real life, right? The reason why I would pick this as in a 5 to 10-year horizon is because this is, we have technologies today, we have a lot of advancements in the space, but for the simulation models to mature and actually deploy in scale, there is a lot more work to do.
Yeah. Maybe that's actually probably a good bridge to my next question. Jen, I'll ask it to you. What are the big blockers? I think that path is very inspiring. Typically, when there's big transformation like this, there's some things that get in the way of actually realizing that. What's your perspective on the things we should look out for that could block us?
I think particularly in the healthcare delivery side, what I find is that most organizations aren't in a really advanced space for their data architecture and modernization to be able to really leverage IT. In part, I think because when we think about the revenue cycle on the healthcare side, it maybe happens once a year. It's from July to July, and the IT budget is going up against new programs and buildings and critical equipment replacement. And so I think from that perspective, it becomes really challenging to say, okay, how do we invest in technology? So right now, the default has really been, let's invest in our transactional data input systems, like our EHRs, which are totally necessary. And then let's make some kind of a data warehouse, which over time grows and becomes a bigger fixed cost in the organization. But yet, you can't now get the data out of that because you have a very constrained workforce who knows how to do things like SQL code. So I'm always really intrigued by that part of it. I think the other piece too is workforce. I think that more and more I'm starting to see healthcare systems and payers that are the most sort of advanced in their AI adoption have really turned their IT shops into more of like a developer framework, as opposed to I'm an analyst, I'm fixing dictionaries and that sort of thing. But I think the last thing still is really largely cultural within the healthcare space. I go back to, I got into tech because I was just super, super burned out. I remember I spent a summer like rounding and my kids were little and I would go in a room and I'd be like, I wonder if that's how I'm gonna die, which is super weird. And I at least had the good sense to say to a mentor of mine, what should I do? And I ended up taking on a degree in healthcare quality and patient safety, and that really transformed my perspective in the sense that I didn't understand that what I was really suffering from in the healthcare space wasn't that I didn't want to do a good job, but the constant stress of keeping all of the balls in the air, and that when you find out you did something wrong, it's because somebody is hurt or somebody is mad. And over time, that just degrades your whole perception, and you begin to like have to nitpick all of the little tiny things that you do to try to keep the system together. So this concept of system redesign became really important. And it was all around the time that we started talking about quality measures. So, I'm at Inovalon, and you guys know a lot about that. But at the same time, I think we've really misfired a little bit on quality measures because so much of it's about who's going to pay for the stuff. And honestly, sepsis doesn't actually care who your payer is. So when I work in a largely rural health system, I need to understand how to take care of a sepsis patient who's 3.5 hours away from me, but in my reporting, that doesn't count because they didn't start in my emergency department. So by the time I have any insight about what actually happened, I can't actually do anything about it. And I think the last thing is, as it relates to culture, is shame has been a big part of enforcing performance in the healthcare space for many, many years. We've seen in the last few years people who've been entangled in medical error actually be taken to court because there was a death. And so I think as long as we're going to be really punitive, that alone is going to stop us. So I'd really like us to see us step back a little bit and start really talking about system redesign, because system redesign is what's going to get the scale. What you have in healthcare, honestly, is a bunch of highly diligent people whose vocation is to heal. And so they will literally do anything that you ask them to do. Like, for example, are you safe at home? Right? Everybody's had that question when they go to the doctor. So I think we just need to be really in recognition of that and start watching the humans who do the work and let them sort of help us understand what to do. And that's going to get us a lot farther.
Yeah, it's a really great point. I do think, despite this being a technology discussion, it being personal and impacting people's lives is ultimately what we're all here for. Todd, I'd love to hear your perspective, maybe with a life sciences angle.
Sure.
What's holding life sciences firms back in sort of realizing this opportunity?
Yeah, a lot of it's similar. Like you said, there's so much around the technology. We talk about data and security as sort of your ticket to entry, but so much is related to culture, process, people, right? We forget that we're asking people to change their behaviors, to do things differently, to work differently, to learn something that can be a little scary. So we always talk about first starting with inspiration, like helping people understand, like, how can this unlock their ability to do more, to help more people, to your point, to like care better, to have better outcomes. And then it comes down to how do you then organize that work? Like, how do you take that inspiration, organize that energy to something that's effective and impactful? So aligning that in particular to whatever those outcomes are that the organization's aiming for, right? We always talk about there's no such thing as an AI strategy, in my opinion. You have business outcomes, you have client and patient outcomes that you're aiming for, and you're building technology to advance those. So making sure that there's a really strong connectivity between anything that you're embarking upon and those outcomes, and making sure that people working on that project, whether it's technology or otherwise, understand what that connectivity is, understand what the measures of success are, and how that's going to have an impact either on the patient or on discovery. You mentioned the drug discovery side of it. It was interesting as they started to enable scientists to use these technologies. What they found out, you would have thought in other parts of this world, you see that it advances earlier stage people, right? So in the call center example, folks who are new to the call center become much more effective faster because they have these technologies. What they found on the research side is that didn't actually occur, but the people who were already really good got even better. They got even more effective. So that idea of being able to enable sort of the inspiration and intelligence and taking away sort of the drudgery of the other things that they were doing has been super, super important from that perspective.
Yeah. Well, I think it's interesting because, again, we're talking about where we see speed of adoption of some of these technologies. There is definitely a difference between the clinical versus the non-clinical domains, because obviously the clinical domain, the regulated space, is going to be much tougher to get things through. Initially, there are over 1,000 FDA-approved medical devices with AI in them. Getting things into production is actually much faster, either in the preclinical space with the drug discovery or in the non-clinical kind of operational space of health systems. So we work with Jupiter Medical Center in Texas, and they had their agentic piece of their call center built on top of Connect, which is our call center solution. And they were able to, they had over 1,800 patients waiting for appointments. Wow. And over a 10%, over a 9% call drop rate. So people are phoning up saying, hey, where's my appointment? but they were just putting the phone down because they weren't getting through. And with introduction of agentic workflows behind the scenes, they were able to get that down, able to reduce that wait list by 60% in 3 months and get their call drop rate down to less than 4%. Wow. And so again, I think there's the technology there, that just the operational piece can be much quicker. And again, to your point about, technology's got in the way a lot when technology's coming through and the applications have been, you've got to fight with the applications to do the job. And the best piece is when technology disappears into the background. And if you can create technology which is so simple and so enabled and so embedded that it just happens and you can get on with the job, that's where magic happens. And I think, again, that's what Inovalon's building.
That's great. Maybe a follow-up question on I think you've sort of gone on the record saying there's lots of pilots and not a lot of traction coming off the back of those pilots. I bring it up because I think you're right. When we think about what actually helps break through there, what makes those things successful, how should we all be thinking about trying things, testing things, but ultimately getting to a point where they're delivering real value for customers?
Yeah, that comes back to that organizing that energy, is sort of, and that connectivity back to what the outcome is supposed to be. I think what happened over the first couple of years of this journey is that excitement became sprawl.
Yeah.
Right, and that's okay. I mean, organizations have to learn, right? You have to build fluency and all those sorts of things, but we're not in a stage where you can just fail for failure's purpose. I think failure is going to occur, but you need to be failing forward towards an outcome, towards a goal of some sort, so that you're learning something through the process and then getting to the next stage through that. I mean, we try to organize the thought across 4 main areas. One is, how are you empowering your people to enrich their experience, to remove drudgery from their work, to allow them to unlock their capabilities. The second area we try to focus is on how do you engage with your customers, whether it's the patients, whether it's the doctors, the surgeons. How can you reinvent that relationship? The third area is internal. We ask people to focus on how are you running your business and how would you change how you run your business based on the fact that you have these capabilities available to you. And the last is on innovation, that bending the curve on innovation. So kind of trying to organize that thought into particular areas, and then that way you can kind of move forward in an organized way with an outcome that's in mind.
That's great. That's really great. Yeah. One thing that you mentioned was regulatory. I think we haven't really hit that one head on, but this is really a question for everybody. Are there regulatory blockers here that maybe are getting better, maybe not getting better, but that are sort of fundamental for us reaching that point where it's real-time care and we're delivering this to customers in a much more fluid way?
I'll just say, I think the current administration has got a very, very clear agenda that they want to kind of free up data from systems of record. And I think they're very, very vocal about they want to make sure that, I think to your point about making, to get between that layer 1 and layer 2, between the application layer to the data layer, I think the current administration are very focused on that. So I'm very keen to see where we go, because again, I think that will really empower what Inovalon's doing at a national scale to make that data available. So I think there are regulatory blockers. Every system manages its own internal systems to try and do things in a compliant manner. But I think where there's top-down mandate to get things done, hopefully we'll get things progressing.
Yeah. Then, sorry.
Well, I think one of the big challenges in at least the healthcare space is regulatory moves a lot slower than tech does. And so we're sort of left with this nebulousness. So I think, when it comes to looking at things like operational efficiencies and just like, the way that you make things happen in your organization, that really comes back to like HIPAA compliance. But when I think about regulation around things like, EHRs and certification in that way, a lot of times you get the regulation to come out and then they have to be compliant, 6 to 8 weeks after that. And I don't think there's any opportunity to do any like user testing. So unfortunately, because in the healthcare space, and I'm really talking about the healthcare delivery space, because the EHRs are so, the regulation is so important for that sector, it really leaves the users with a really rigid workflow. And that's what's so exciting about AI and agentic capabilities is for the first time, you're going to actually, I think, have the ability to sort of personalize to the user. Because if Jen McKay always forgets to do a certain thing at the end of every clinic visit, I can have my little agent say, hey, Jen, don't forget to ask about X, Y, or Z. So I'd just say that I think what I'm seeing is, just today and the here and now, a tendency toward less regulation than more, but I still think we need to move a little bit quicker and get the right stakeholders at the table to have those discussions about where the real pitfalls are. And those are always like right in the front line with the everyday user that we often kind of miss the difficulties they have.
If you want to bridge that gap, I mean, that's a fantastic point, Dr. Jen. If you want to bridge the gap of the regulatory compliance, right? There's going to be compliance, that should be compliance, right? We have technology, and that technology is getting innovated at a very rapid clip. But what is not catching up to that is, when the technology is evolving, are we evaluating that technology from a context of safety, bias, and transparency? I think that is not catching up. If that is not catching up, then it is very hard to meet these regulatory compliance, because the regulatory compliance is going to be revolving around that. I think, if we truly want to accomplish what some of the things that we talked about in this panel, we have to actually move the needle on how do we evaluate these technologies from these safety, bias, and transparency angles at the same speed in which we innovate the technology, right? When we do that, we're going to see these technologies getting adopted at scale, right? So.
Yeah, I mean, I think the only certainty is it's uncertain, right? And at this point, and so there's a couple of things. So building on what you're saying, Murali, is like there's a need to be able to have that transparency, to have like the technology in place to trace how the decisions are being made and be able to capture that and share that so that you're prepared as things change. I also think organizations need to look at itself and say, what does responsible AI or responsible technology evolution mean to us? And how do we define that? How do we align that to our values, align it to what we think our industry requires, and then build the internal processes as well as capabilities technically to enforce that mindset throughout the organization as you move forward, so that you're prepared as these things change and evolve.
Yeah, and we tend to follow a shared responsibility model. So obviously the technology is one part, and we can ensure the technology piece works, but making sure that those that are building on top also have the right tools available to make themselves compliant. I think that's the other thing that's also really important.
Yeah.
And to make it easy to be compliant. Yeah. That's essential.
Yeah.
I'd just add one last thing. If you compare it to what's happening on the consumer side of healthcare, where you've got the ability to hyper-personalize, you've got these concepts of health coaches and how quickly that's evolving, it would be awesome if we could get the same speed of innovation in the enterprise space that we have in the consumer space. And I would say it's probably all related to trying to align with regulation in a timely way. And I think the general consensus from all of us would be, we understand why it's there, we know it needs to be there, and also let's figure out how to do it a little bit differently so that we can understand that we have this incredible workforce that's just sagging under the tech debt.
Yeah. I do feel like we're in DC and you're all in front of me. I feel like we're right there. We're in an industry where this stuff does matter, and actually pushing through. I agree with you on the enterprise side, especially. There's real opportunity. I think we're all well positioned to go after it, and super excited to do it collectively. I want to thank all of you for what's been a very energizing discussion. Hopefully it's been great for all of you. Final question, maybe one leave behind for the audience. Hopefully nobody's had coffee in 30 minutes, so like a good inspirational last tidbit, but maybe we'll start on this end and work our way over.
But I mean, my takeaway is, as I said, I think unless you are really thinking about how to use agents in the future, how you can expand your workforce virtually, how you can really make sure that everyone's working at the top of their license and taking away some of the heavy lifting, repetitive tasks that they do. All of your workforce should be supported by a fleet of agents. And so really thinking with that way in mind, and then how we can work back from, just choose your biggest problem and then build to support that. And then we've got some great partners, that can build out those things for you. I think that really, that's going to be the way of the future.
Like that.
I'm sure many of us in the room would have seen the Matrix movie. And in the movie, there is a scene where Neo and Trinity basically helps Morpheus escape from the building, and they are on the top floor, and there is this helicopter, and so Neo asks Trinity, can you fly that thing? And she responds, not yet, and then calls the operator, Tank, can you upload the program to fly this helicopter? And Tank does so, and then Trinity flies that. The reason I bring this is because knowledge is democratized today, right? See, when I grew up, right, knowledge is a differentiator. But today, that knowledge is commoditized. So I think what's going to help us kind of be into the next age is our curiosity, our ability to ask right questions, tap into that knowledge that is already available, like how Trinity did when there was a need. She wasn't a pilot to begin with, but she was able to get that information, knowledge, just in time to solve a problem, right? So ability to stay curious, how do we apply the knowledge to solve the problem is probably how the future is gonna be. It's a little bit scary, but it's also, we have to look at it from an opportunistic way. What we call it as dynamic intelligence, right? So very exciting times we live in. Yeah, so.
One of the most memorable nights I ever had in my practice was Christmas night, probably 10 or 15 years ago, and I was taking care of a patient. I live in South Dakota, and we had a terrible snowstorm that shut the interstate down from east to west, north to south, and nothing was moving. And I had this family who was grieving this loved one. They were really having a hard time. It was evident the person was going to be dying. And I just sat with them at 2 in the morning, and they just told me stories, about all of the things. And all of a sudden, I had this understanding of why they were so afraid to let this person go. And a few years later, I actually had my team do just how long am I in the EHR every day? And out of a 12-hour hospital shift, I was in the EHR 10 of those hours. And when it comes to things like burnout, and we talk about administrative burden, what we're really talking about is all of the effort it takes to keep, as I said, the balls in the air. Technology has the opportunity to really give us back that time, so we get a lot more of those really, really important moments that feed our hearts and souls to ourselves, but also to our patients. And it doesn't happen if you don't have clinical leaders at the table with you. If I had $1 for every time I've gotten into a project where if they had just brought in the clinical expert doing the work to the table at the beginning, I would probably be able to retire. But also the teams can work a lot faster. So if I leave you with one thing today, it's in order for you to give us that time back, it's really important that you have those clinical leaders at the table with you.
That's great. I love that. I really do. I mean, for me, we talk a lot about the opportunity to have these transformative outcomes. And I think we should talk more about transformative outcomes for everyone. I think there's a huge opportunity around driving equity in healthcare and leveraging these new technologies that kind of gets left behind in the conversation. Great example, we worked really closely with Stanford Medical Center to help them run more effective and more efficient tumor boards. Stanford Medical Center can do 4,000 of those a year, and they can do more now because of that. Amazing, life-saving thing. But what's exciting about that is then making that available to rural healthcare providers who would never, ever be able to run a tumor board, a single tumor board, and bringing that opportunity to people and saving lives in that way. So I think keeping that in mind and not deferring that responsibility just to the care delivery side of things and the clinical side of things, but that responsibility in my mind runs all the way from the discovery of new drugs and the entire process that we run through. So if I was to leave anything in the room, I think more broadly from that perspective.
Fantastic. All right. Well, thank you so much on behalf of the panel. Thank you so much for attending. I think we'll wrap it there.
Thank you.
Thank you.